Hi, everybody. It's Joni from Safe at Home Physio. I have one of my dearest friends with me today, Nadine Cram. She is an ICU nurse, and she's worked in several areas in the United States, including Seattle, and lives in Washington State currently. Hi, Nadine.
Hi.
So we wanted to talk today about CPR and AEDs because I took a course a couple months ago, and they had said that the survival rate here is only like 3%, but in Seattle, it's like 63%. So I thought I better go to an expert and see what's going on there. So can you tell me and the listeners about yourself and kind of where your journey started and what you do now as a nurse?
Sure. Well, I started in Canada. I was trained at Dalhousie University and decided to come down to the United States. My first job was actually in South Florida. Eventually, I became a trauma ICU nurse. And so from there, I've just done a lot of different ICUs. And I started traveling and ended up in Seattle, where I worked in neuro ICU and a cardiovascular ICU. So, yeah.
So I'm gonna guess that you've probably done a little bit of CPR in your career.
Just a little bit, yeah. Just a
So
little bit.
it's not mandatory where I was working in a nursing home in Halifax to keep up with my CPR. So I just kind of let it lapse. And I probably didn't take it for 6 or 7 years. And then when I went back, it was the same thing. Like I was ski patrol. So we used to do intensive stuff. Like we would do 40, 50 hours of training every year on first aid. But it's surprising how fast you forget how to do it. Like the lay person that takes a first aid or CPR course never really needs to use it. So, do you want to tell a little the viewers what is CPR? Because some people might not even understand what it is.
So CPR is cardiopulmonary resuscitation. So it's basically if you find a person without a pulse and not breathing, you're pumping their blood for them. So you're pumping on their chest and breathing for them if you can. Now we're telling people that just pumping on, just doing the compressions is what we call it, is enough. So if you, especially in this pandemic time, if you don't want to breathe into somebody's mouth because you don't have the proper equipment, just doing hands only CPR is enough until you can get an AED. That's basically our main goal, is getting the AED to that person. That's what saves lives. It's not the CPR that saves lives, it's the AED that saves lives.
Okay, so my next question is, what's an AED?
Um, so it's
Automatic
basically,
external defibrillator.
I was going to say, it's basically a defibrillator. So
Yeah.
it's a lot of reasons people have cardiac arrest is not because their heart stops, it's because their heart starts fibrillating. So it starts going like this. Getting electricity to that heart and shocking it out of that rhythm and getting it back into a normal rhythm is what's going to save their lives. You doing the CPR is going to help to keep the heart fibrillating so that it doesn't stop. Because if you do nothing, the heart will fibrillate and then eventually will just stop functioning and you can't get the electrical activity back.
Okay, so when you take the first aid course, the first thing they say is call 911. Unless you're working with an infant, it's a slightly different process. But the average person falls down, you don't see them breathing, and you're not really sure if they have a pulse. Call 911 and get on their chest, right?
Yep.
So the next step you're telling us is to get somebody to get you an AED.
Yep. So here's a really, and I don't know what the laws are like in Nova Scotia, but here there's actually an entire database. So when you call 911, they will direct that person to the nearest AED. So if there's a store next door to you that has an AED, they'll tell you, send somebody to this store, this address, and get that AED and get back to me.
So in Nova Scotia, it is not law to have AEDs in public buildings. They do have a bill 94 was put in by the NDP, and it's I think it's going into a second reading soon. So if it's passed, then public buildings in Nova Scotia will require AEDs. But right now, only Manitoba is the only province or territory that I'm aware of that has that law. So
statewide, Washington State, in King County especially, which is Seattle, it's law. So if you own a convenience store, if you're in a public place, if you own a public place where you have customers, you have an AED. But in Washington State, if you use an AED on someone and it doesn't work or it causes them harm, you can't be sued or penalized for that. As long as you're trying to do your best, then you can't be penalized, which I think allows a lot more people to go ahead and use it and not be fearful of the repercussions.
Yeah, and I'll put a link in the bottom about the actual bill, because Bill 94, I read over it this morning. I'm not a lawyer, but what's very clear is exactly that. If you try to use it, so if you're a healthcare provider and you don't use CPR or defibrillators regularly in your job, like somebody like me, then I can't be penalized, and then the layperson wouldn't be penalized. And then the AED is really great because it actually talks you through everything. So when we see people being defibrillated in movies, like Anatomy or whatever, it's like clear, and there's one shock or two shocks, and the person just gets up and everything's fine. I don't think that's exactly how it happens. So it talks about exactly places. Each pad has a picture of and writing of where exactly to put it. And it's it talks, it's automated, so it tells you, and then it says shocking now. And so it is pretty foolproof. And I think you told me before,
I say it's very, very dummy proof, as long as you do the very first thing, which is turn it on. It will walk you through the whole rest of the activities that you have to do, but you have to turn it on first. So
I'm going to say, we're laughing about this right now, like how silly would it be to forget turning it on. But when you're in a crisis and your loved one is squatting on the ground, like fall on the ground, like it's really simple to forget to call 911. It's very simple to forget, like in that moment, what do you do? So I think that's why it's important for everybody to take these CPR courses. So the one I took was, I can't remember the guy's name. The guy's name was Kyle, and he is in Dartmouth. I think it's Life Shield is the name of the company. And he was awesome. He brought in some great stats. So that's why I called you, I think, right after I took the course, because I knew you had worked in Seattle and you're still in the area. And it was like 3% survival rate here. And I mean, I know some of it has to do with how far you're away from emergencies and stuff, but we don't have to take a CPR course. And even medical providers working in professions with very frail elderly people, and we don't even have, like, as a working in a nursing home, I didn't have to keep up my CPR as a medical professional, which is in hindsight ridiculous, right?
So and that's another so that's another thing. All of the hospitals in Washington State, any medical provider, including our secretaries, have to have BLS, which is essentially CPR, have to be BLS trained in order to assist during a code. So all of our physical therapy, occupational therapy, nursing assistants, secretaries, monitor techs, all of them have to be certified in CPR.
Yeah, and right down to somebody that cleans the floors, because they might be the one that stumbles upon them, really. Like just say your mother or your partner has a cardiac issue, would you recommend that person goes and gets a CPR course?
Oh, absolutely. Absolutely. And it's so easy and it's so quick. And now, even during the pandemic, they have very amazing online courses that you can do.
Why are the rates so high in Seattle specifically? So they talked about that in my course, that CPR and AED combined is 60% effective for people actually being discharged from hospital. So not only reviving them, but actually rehabbing them to the point where they can leave the facility. But also, people are trained in high school, right? You can't graduate high school in Seattle without having a CPR course. So that would be amazing.
CPR course, yep.
We don't think about our teenagers having CPR courses, but they're the ones that might come across mom or dad who's had the heart attack. Anyway, thanks so much for your time, everybody. And go get that CPR course and find out where the AEDs are near you.
Everybody, thanks for watching this video. I just want to let you know quickly about a new special I'm running for all new clients. It's only $69. That's $150 value for a limited time only. For that, you get a visit one-on-one with me in your home for 45 minutes. We'll screen for COVID before I come to make sure everybody's safe. I'm going to review your medical history and medication with you, check your pulse, oxygen, and blood pressure, and then we'll get right into it and analyze the movement and strength of your problem area, scan for balance and coordination issues, and review any equipment needs you might have. Then I'll analyze the findings and give them to you and tell you what the next steps are. So if you're interested or you know anybody who may benefit, please contact me at 902-809-1793, or you can book directly at safeathomephysio.ca. Have a great day.